I'm with JoAnn Gurenlian. She is the president of Gurenlian and Associates in Haddonfield, New Jersey. She writes a column for RDH magazine called Looking Ahead, and her April column is about dental care for the elderly. She starts off with an anecdote about her own father. Uh, who is getting up in the years and somewhat frail, and she meets with her siblings about what to do about his care in terms of a long-term assisted facility. And it turns out that she is the only one who has cold feet about the idea, if you will. So, JoAnn, can we start there? And good morning to you, by the way, and can we start there about why you were so concerned about that possibility?
Sure. Good morning, Mark. It's a pleasure to be speaking with you today about this topic. I started getting concerned about this about 5 or 6 years ago. Casey Hine, a colleague of ours in dental hygiene, had invited me to testify before a Senate subcommittee about the oral health care of the elderly and supporting models of oral health interventions in long-term care facilities. And at that time, I became more aware of the frightening statistics about how vulnerable our elderly population is. And I found and discovered that these individuals have a high propensity towards dental decay, pain, difficulty chewing and swallowing, periodontal disease, tooth loss, along with the implications of propensity towards pneumonia in long-term care facilities. So as I investigated this further, Casey and I and a colleague in nursing wrote an article about the nature of oral health care in long-term care facilities. And some of the things that we discovered was that there's very little oral health care at all. What does exist may be done by an aide, and they may spend 20 seconds or less working with someone in their oral health care. If someone has dentures, the dentures may be switched among patients and not really cared for properly. Some individuals may drop their toothbrush and the aide will pick it up and put it back in the patient's mouth. And many patients have no oral health care at all, despite the fact that there may be some individuals in oral health care who do go into long-term care facilities and provide education about regular daily oral health care for these patients. So I became very concerned about that, and when my father became ill, it became clear to me that this was truly an issue that would need to be addressed for his health and well-being. And I'm living the nightmare right now. He became very ill again, and we had to place him in a rehab facility. There wasn't one available that was just designed for that, so we had to put him in a long-term care facility for several days. And aside from the fact that he had no oral health care, there were safety and health issues, and we just moved him into a regular rehab facility again, where I'm happy to say he is getting oral health care. But it has convinced me, Mark, that we need to do better in this area. We can do better, and our whole all of our oral health care professionals should be addressing this issue, working as a team to try to create the models for providing better oral health interventions in long-term care facilities.
Well, you had mentioned in the column that 23% I guess Americans, since the report came from the CDC, that 23% of Americans between the ages of 65 and 74 have severe periodontal disease. But the column focuses, well, I don't want to say focus, but you talk a bit about the WHO Global Oral Health Program that was conducted, I guess, a couple of years ago, and you suggested using that as a model for caring for the elderly. Can you elaborate a little bit on that?
I have to say, Mark, I'm really delighted that this isn't just an issue for America. It's an issue for the entire the world to be addressing. And the World Health Organization has partnered with some other international dental organizations to begin to address this issue of providing better oral health care for the elderly. And they are advocating that we we look at the opportunities to provide better education for those individuals who are caring for patients in long-term care facilities, that we also structure better curricula in dental and dental hygiene programs so that students are having direct care opportunities in these kinds of settings. I think that if our students really had firsthand experience and understood the severity of the situation, they would be more inclined to work with other healthcare providers in addressing this issue. Because we all have to recognize we are getting older. All of us will age at some point. And if we don't create the models and the structures for addressing this, we will be our own victims at some point in time in this area. And I think that to have international organizations championing this cause is very worthwhile and something that our American counterpart professional organizations could be looking at and addressing as well. There are so many times where we all want to have something that's very special for our professions. This is a golden opportunity, and I think it's easy to focus on other vulnerable groups like children, and I'm not saying they're not important, but I think we have systems in place in many cases that can address the oral health diseases of children, but we are completely lacking in this area for the elderly. And my hope is that by pointing out this issue, that we can take it on as a group that are very caring and concerned professionals and look at what would be the structures or the systems that we could put in place. It's a perfect opportunity to work with other healthcare providers. It's an opportunity to work with those who influence health policy positions, our legislators. Perfect opportunity to do some research projects where we could maybe obtain some grant money from the National Institutes of Health or other organizations that have concerns about elder care. And again, create these systems that provide for better health for the public.
Okay, well, that's a good point, JoAnn. Again, this column appears in the April issue of RDH magazine, and I want to thank you, JoAnn, for your time this morning, and I hope everything goes well with your care for your father, So.
Thank you, Mark.